My name is Mike Mraz, and I'm the NDP candidate here in River Heights. I'd like to begin by introducing a wonderful River Heights family. Madeline, Ben, and baby Maxine, who are standing with us today. Access to fast, quality health care for families is critically important. Families want and deserve health care they can rely on. Here in River Heights, we're lucky to have the Corydon, which is a great clinic. But for many families in Manitoba, that isn't the case. Because under Heather Stephenson, healthcare just isn't working. It isn't working when you go to the ER and get stuck waiting all night for care. It isn't working when you need a checkup but can't find a family doctor. And it isn't working when you get injured or you get sick and you need care close to home. Manitobans deserve better. You and your families deserve better health care. That's why I'm proud to be standing here today with Wob. Because as a leader, I've seen how deeply he cares for families across this province. Wob and our NDP team will make healthcare better at all levels, including getting care in your neighborhood. Our plan will help more families get the care they need closer to home. Here in River Heights and across the province, we can come together to make this plan a reality. Together, we can vote for better health care. To talk more about our plan, I'd like to welcome Wob Kinew, leader of the Manitoba NDP.
Thanks, Mike.
Thanks, Wob.
Right on. So move this for a bit. I'll put it back later. Oh. How do you do? I'm Wob Kinew, and I'm running to be your premier so that you can have better health care in Manitoba. Today, we're proposing a new approach to health care, an approach where if you have an injury or an illness for yourself or a family member, that you can make an appointment online. You can be seen by an emergency room doctor, and you could be back in your car within 15 minutes. I'm committing to neighborhood illness and injury clinics like the one we see behind us on Corydon. These allow you to be seen by an emergency room doctor who will quickly be able to triage your situation, deliver the care that you need, whether that's a cast, stitches, maybe a prescription, or in the case of something more serious, be able to identify the early warning signs and refer you to a higher level of care. This is meeting you and your family where you are today. It's time that healthcare responds to the quality of life that you have. Booking appointments on your phone, being close to you in the neighborhood where you choose to live in this province, and of course, delivering hours and care with the highest quality, but that work around your schedule. We have a great local innovation here in the province that has been led by local physicians, by local healthcare practitioners. And it's time that we have a government that supports these local innovations so that we can build up public health care in Manitoba and guarantee you and your family the care that you need. Close to home, but also according to the hours when you need it. So I want to explain a little bit about what this idea is all about. Behind me is the Corydon Minor Illness and Injury Clinic. Now, this is a great clinic that provides convenient, high-quality care without the wait. You can book online to be seen by one of the emergency room physicians who works here on their days off from the ER. Whether you have a broken bone, whether you have a situation that might require stitches, maybe you had a fall around the house, maybe like myself, you think your home reno skills are a bit stronger than they actually are. This is a place where you can get in and seen and treated quickly while skipping the emergency room. The best part is it works around you and your family. You can be seen before you have to go to work. You can be seen after the... We're going to fix healthcare 100%, and we're going to lower your cost of living each and every month. Absolutely.
I'm not an NDP guy, but you're
Appreciate it, man. We'll follow through on the commitment. Thank you so much.
I hope so, because if not...
Thank you, man. Have a great one. So this plan that we're rolling out here today, as you just heard, is part of a comprehensive and integrated plan for healthcare in Manitoba. It started with our commitment to staff up healthcare, hire more nurses and doctors. It continues with our commitment on emergency rooms here in the city and also in rural Manitoba. And this phase that we're announcing now is when you need that level of care in between. More serious than something that you'd want to wait at a walk-in clinic or to make an appointment with your family doctor, but not something that requires a trip to an emergency room. And so these local physicians who've come up with this clinical model here have really hit on something that I think would work for you and your family. The ability to book online, get seen by emergency room experts so that you're triaged and treated with exceptional skill, and then you can get on with your day. And by the way, if there is something more serious at play, they'll be able to flag that and treat you for it or refer you to that other level of care. I really think that this is an idea whose time has come. Not only is this going to help you and your family get the health care that you need, this is also going to ease the burden on our emergency rooms. Over the past 7 years, the PC plan has been apparently just to put billboards up and expect people to try to choose a different destination than the emergency room. But our plan is going to make it so easy and convenient for your family that you're going to choose to attend a clinic like this one instead of visiting an emergency room. So my hope is that as you're raising kids, as you're choosing to live independently in one of our great communities across Manitoba, that you'll never need to access these higher levels of care. But when you do, we want to make sure that you can be seen quickly and conveniently, and you can skip the wait times as much as possible. So I'm happy to answer questions on this proposal in just a few minutes, but first I want to invite up some of the community members who've joined us today to share a bit of their words. There you go. Thanks.
Awesome. Thanks so much. Hello, my name is Ben Bradley. I live here in River Heights, right just down the way, a couple blocks. I'm here today because I'm excited to support WOB and the NDP's announcement that they're planning to build more neighborhood illness and injury clinics. Having a clinic like this in our neighborhood is so important. I know this because I've benefited from our own neighborhood clinic. A couple of years ago, my wife and I bought our first house. I was doing a little bit of yard work in the back along with my partner here. Bent down, doing something in the garden, stood up a little bit too fast, knocked my head right on a rusty piece of metal that was hanging off our deck. I ended up with an open wound on my head. It was stressful, partly because I was hurt, but partly because I didn't know where to go for care. I didn't want to go wait in the ER, but then we remembered, hey, we have this minor injury and illness clinic just down the street. So I gave the clinic a call. I made an appointment. They were able to see me within the hour. I was in and out within 20 minutes, 4 stitches. They healed really nicely. You can barely see the scar. Had a tetanus shot, which I was due for anyway, so that was great. And then we were out of there. The experience was amazing. This is exactly the way that I think Manitobans should expect to receive healthcare in the province. And I really want more people to have access to the same sort of neighborhood clinic. That's why I'm here supporting WOB's commitment today. Thank you so much.
That's great. Well, I'm so glad to hear you had a good experience with the clinic. And so just to, conclude these opening comments, what we have in mind is to create 4 neighborhood illness and injury clinics in Winnipeg and 1 in Brandon. So we would put in place financial incentives so these emergency room physicians can stand up clinics in a neighborhood like Bridgewater, Sage Creek, Devonshire, and Amber Trail. 1 in each quadrant of the city of Winnipeg, and then of course 1 in Brandon as well. So This is an exciting, innovative approach to healthcare that's being led by local leaders, local doctors, and we're very proud to announce our commitment to work with them and you to make life better together. Yeah, happy to take any questions on this and then other topics after that. Yeah.
How is this different than the access care clinics?
These are clinics where you can book online and be seen by an emergency room doctor. And then they'll treat you, they'll put the cast on, stitches, perhaps a prescription, and then you can be back in your vehicle and on your way within 15 minutes. Our vision, once we phase this in over a term in government, is that if you live in southwest Winnipeg and you have an accident at the playground, you can take your family to one of these clinics, make the appointment on your phone before you hop into your vehicle, drive there, be seen, assessed, treated, and then be back on your way to either get on with your day or perhaps just a little R&R time at home. Really, this is about catering a higher level of medical intervention to your family if you should need it in a way that works around your schedule, in a way that fits in with the way we all lead our lives today, which is using our phones and being able to access services close to where we live. And so this is a very exciting innovation, and it really does give you that access to an emergency room doctor the same way as if you showed up in an ER, but you're going to be able to skip the waiting room and be able to book online, but still count on that same level of expertise to care for you and potentially flag a more serious issue if that is what's actually taking place. That's right. And so our specific, I guess, financial commitment that we're making today is that we're going to put in place a financial incentive program so that we can create these clinics in southwest Winnipeg, southeast Winnipeg, northeast Winnipeg, northwest Winnipeg, as well as one in Brandon. Specifically, this incentive will offer a stipend to the emergency room physicians who would staff up these neighborhood injury and illness clinics. It would cover the cost of having a nurse staffing the clinic throughout the hours that it is open, and it would also cover the supply costs for each of these clinics. We estimate that this will be a $2 million annual expense for each of the clinics as we stand them up, and we'll be proceeding with a phased-in approach, meaning one clinic in year one, a second clinic in year two, and then the third, fourth, and fifth clinics in year 3 and 4 of a mandate, should we earn the great privilege of governing here in Manitoba.
Are you confident this position will you've actually run this
Yeah, we've been working with doctors in developing this plan, and they tell us that working in a setting like this is very rewarding for them. It's rewarding for them in the sense that they can still practice the skills that they want to keep sharp, but they also are able to have a little bit more predictability and work-life balance in terms of their own schedules. So what we're talking about here today is really an innovation to healthcare that is going to make things more convenient for you and your family when you need to get the stitches or the cast, but it's also going to be a powerful recruiting tool and retention tool for emergency room physicians in Manitoba. So let's recall that we're competing against other provinces right now for ER doctors, for nurses, for other people who work in the healthcare system. And you look at parts of our healthcare system that have a staffing shortage, like say Western Manitoba in the Prairie Mountain Health Region. Well, if we want more ER docs to move to Brandon, to move to Verdun, to move to Carberry, one of the value propositions we can say is, you know what, you're going to have the opportunity to take the shift in your local emergency department, but we're also standing up this neighborhood injury and illness clinic where you'll be able to take shifts that work with your schedule, allow you to keep your skills sharp, and most importantly, deliver that meaningful care to patients and improve their lives in the way that you want to pursue. So I think this is a really powerful tool. It's not only innovation for the patient, it's innovation for the patient that helps us recruit and retain more physicians and healthcare staff by making Manitoba an exciting place to work in healthcare. The financial incentive program is what is going to draw the emergency room physicians to staff up these locations. That combined with the flexibility and the work-life balance that is afforded to people who work in these clinics, it really makes it a win-win. It's a win in terms of recruiting and retaining emergency room doctors here in Manitoba, but it delivers care to you in a convenient way where you can book online, get treated quickly in a neighborhood clinic near you, and then be back on your day, back on your way to get on with your day within 15 minutes. Ouais. Bien, aujourd'hui, nous sommes très fiers de lancer ce plan pour ajouter 5 plus de cliniques, comme ce qu'on voit ici à Corydon. Et ça, c'est une approche de livrer des services de santé qui marchent pour vous. C'est-à-dire que vous pouvez télécharger une app, faites votre calendrier, puis rendre à une clinique qui est dans un quartier proche à vous, et puis consulter avec un médecin qui travaille 2 autres journées dans une salle d'urgence, qui va soigner pour toi ou tes enfants. Et puis après ça, après 15 minutes, tu serais prêt de continuer avec votre journée.
C'est quoi la particularité de ces cliniques-là?
C'est des médecins qui travaillent dans les salles d'urgence. C'est-à-dire, dans des autres cliniques, ça se peut que ça pourrait être un médecin pour des familles. Il pourrait livrer des services excellents, mais dans une situation d'urgence, c'est-à-dire peut-être on a cassé un bras ou peut-être on a besoin d'un autre service urgent, cette approche vous donne l'opportunité de consulter avec un médecin qui a cette expérience dans des situations d'urgence, mais ça garde ces approches qui marchent pour vous, avec ton calendrier dans un quartier chez vous.
Et donc, pour le financement et la main-d'œuvre, comment est-ce que ça va fonctionner?
Bien, nous ajouterons 10 millions de dollars à chaque année pour chaque clinique. Alors, 1 dans la première année, 2 dans la deuxième année, et puis les 3, 4 et 5e dans les 3e et 4e années du gouvernement néo.
Pour les employés, pour la main-d'œuvre, pour la main-d'œuvre,
Oui, je pense que ça va être un outil pour notre système de santé qui améliorera l'offre de notre province pour les médecins. On pourrait dire, oui, tu pourrais venir ici pour travailler dans une salle d'urgence, mais aussi dans des cliniques qui marchera avec ta vie, qui te donnerait de l'opportunité de pratiquer les skills que vous avez besoin. Et puis, ça marche pour le peuple dans la communauté aussi. Ça va livrer un service essentiel dans une manière unique qui a été créée ici dans le Manitoba. Alors, pour moi, je trouve que c'est une idée très exceptionnelle, très excitante. C'était créé par les Manitobains et Manitobaines et maintenant, nous voulons livrer un service comme ça à plusieurs mondes dans notre province. Ça, c'est une des méthodes qu'on va livrer le système de santé dans l'avenir et on va l'apporter à un quartier plus proche à vous. I think this is really about meeting your needs as a family member, as a senior. We know that accidents happen. You might have a fall down the front steps. The kiddos might wipe out at the playground. We can't predict these things. But what we can do as a government is make sure that you have a convenient approach to healthcare that works for you when these unfortunate incidents occur. And so what we're talking about here is really, I hope that you never really have to access care at this level, but when you do, these will give you the opportunity to skip a trip to the emergency room. You'll be able to have the confidence that if there's something really serious going on, it's going to get caught while you're being triaged in these clinics. But if it's just, what you see is what you get type of situation, you'll get the cast on or you'll get the stitches and you'll be able to be back in your car within 15 minutes of starting this appointment. So this is really a new approach to healthcare. This is something that has not previously existed at a large scale in Manitoba. We're scaling up a local healthcare innovation that these ER docs have come up with. We're going to make it more accessible for folks in Bridgewater and Sage Creek and Devonshire and Amber Trails and in Brandon. And along the way, it's also going to be something that helps us to recruit more physicians to work in the system, because it's a compelling offer for them to be able to continue doing meaningful work that provides a bit more work-life balance for them. And so I think we've got a real winner here. It meets your needs, it makes healthcare more convenient for you and your family, and it allows us also to recruit more physicians to work in our healthcare system in the areas where we need them.
So that's a no to twin care clinics?
I don't recall the way I didn't recall the way you phrased it initially.
Sure. I thought this seems to be a replacement for sort of the twin care clinics. I know they're not exact, but off the 2017, does this replace the need for twin care?
I think this is meeting a different healthcare need. I would hope that if you're the average suburban Winnipegger, the average Brandonite, I would hope that this means you don't have to go to the ER. I would hope that this means that instead of having to go to the ER and sit in the waiting room, if you just have that situation that requires a cast or stitches, you can just pull out your phone, book the appointment, see an ER doc, and be back on your way within 15 minutes. So I think it's really meeting a different level of care, because previously, under the situation that you're talking about, if you had that fall, that broken bone, that laceration, you wouldn't have been able to go to a site like that. You would have had to go to the urgent care or to the ER. And so what we're talking about here, local healthcare innovation, it's something pretty recent that's been pioneered here within the last few years, and we want to scale it up. We think this is a compelling offer that matches the way Manitobans live today, which is the expectation that you can book something on your phone, that you can find a location close to you, still get the highest quality of care, and do that in a way that is also a workable model for the people who work in healthcare. And so I really think it's a win-win. And it's meeting a new need. Or rather, it's meeting an existing need in a new way.
I don't mean to commandeer everything here, but
No,
the PC's promising to get rid of the land transfer tax for first-time
we are on day 2 of the election campaign, and Heather Stephenson is already in hiding. Heather Stephenson called this election. This is a job application. This is a job interview for the job of Premier. If Heather Stephenson wants the job of Premier, she can't keep skipping the job interview appointments each day. Our team has been out for a month. Fully costed promises that are going to fix healthcare for you, lower your costs. We're showing up. We're serious about leading this province. It doesn't appear that the PCs are. I think that this was another one of these back-of-the-envelope announcements that the PCs are coming up with. And the thing that stands out to me is that Heather Stephenson can't even show up to make the announcement. This is day 2 of the election campaign. Again, we're not going to rule things out. We will take a look at different options to help Manitoba families. But if you call an election and you ask Manitobans for the job of being Premier, I think you should show up. I think you should show up for the job interview. I think you should show up to explain your proposals. I think you should show up to explain how you're going to pay for them. That's what we've been doing for more than a month now. And this is day 2 of the election campaign, and already Heather Stephenson is hiding out. So I feel compelled that Manitobans should take note of that.
Right to housing released their housing plan today. Among the pillars are protecting existing social housing stock and adding 1,000 We're asking small buyers to endorse this. What's your thoughts on it?
Well, we've certainly already committed on the housing front that we're going to give a $700 tax credit to renters. We're also going to review the rent control system to make sure that it actually delivers affordability for renters. And of course, we are going to protect not-for-profit housing so that we can avoid a situation like Lions Place from happening again. I think that's what seniors want, that's what people across Manitoba want. And so our team is committed to that, and certainly we'll work with groups like Right to Housing to get it right. And we look forward to reviewing their proposals.
Announcement earlier today, local leader for
The worst thing the PCs did to healthcare was closing 3 emergency rooms. We reject Heather Stephenson and Brian Pallister's plan to close emergency rooms, and that's why our team is committed to building new emergency rooms. You can look at what the Liberals have said on that front, and I believe they're aligned with the PCs on closing emergency rooms.
Okay.
Great. Thanks once again. Remarkable performance for baby's first press conference, I would say.
Vaccines are
Unreal. That was awesome.
Way to go, Max.
Yeah, Maxine.
One little shout.
Oh yeah.
Right.
Yeah, she's a pretty quiet baby.
Yeah, that's sweet. That's sweet.
How old did you say?
3 months.
3 months.
Serious
eh?
scene stealer right there.
So cute. Yeah, for real.